Hello, everyone. My name is Nabeeha Hasan. I am a biomedical research intern and innovation leader at Berkeley Pharmatech. Today, I will be presenting on the drug Bazedoxifene acetate and its potential as a treatment for multiple sclerosis. Now, before I introduce the drug in question, I want to give some background on multiple sclerosis, its symptoms, and current treatments. So starting off with the definition, multiple sclerosis is an autoimmune disease of the central nervous system that causes inflammation, which results in damage to the myelin and oligodendrocytes that surround the nerve fibers, causing scarring and damage to the nerve fibers. To better understand this definition, let us define some key words. An autoimmune disease occurs when the immune cells begin to attack the body's healthy cells instead of diseased cells. In multiple sclerosis, T cells are activated in the lymphatic system and cross the blood-brain barrier to enter the central nervous system through the bloodstream. The mechanisms by which the blood-brain barrier becomes more proliferated for T cells is currently being researched. B cells also play a major role in autoimmune diseases like multiple sclerosis. I will be using the following diagrams to better define the next few keywords. Now, the central nervous system, as depicted here, consists of the brain and the spinal cord. And constituting the central nervous system are billions of cells called neurons. The diagram on the right depicts a neuron. As shown here, the neuron consists of several components essential to its function of relaying information between the central and peripheral nervous system. But the structure that we are most concerned about in regard to multiple sclerosis is the myelin. Myelin is a type of cell that forms a layer of insulation that surrounds our nerves. It is made of lipids and proteins that do not conduct electricity. So myelin allows for the electrical impulses in nerve cells to pass without the loss of signal transduction. The layer that myelin cells form, as displayed over here, is called the myelin sheath. Also depicted in this diagram are the oligodendrocytes, which refer to the cells that construct the myelin sheath in central nervous system nerve fibers. Schwann cells complete this job in the peripheral nervous system. As aforementioned, neurons play the role of transmitting messages in the form of electrical impulses from the brain to the rest of the body and from the rest of the body to the brain. The process by which the myelin of nerve fibers is damaged is called demyelination. In a normal neuron cell, which closely resembles the diagram we looked at in the previous slide, the myelin is intact. Since the myelin allows for the insulation of the nerve cell, the electrical impulse is able to jump from each insulated portion to the next along the axon. So the signal is preserved and successfully transmitted to its target, thus emitting a response. In a damaged nerve cell affected by MS, parts of the myelin sheath, and sometimes even parts of the nerve cell, are severely damaged. The impulse thus cannot be preserved and is not successfully passed through the axon and to its target, so there is an abnormal response. Symptoms of multiple sclerosis can vary from patient to patient, depending on which area of the central nervous system is impacted most by demyelination. In the case of multiple sclerosis, pain can occur behind the eyes, in the head, and in the legs and back. This pain may be of two types. The first is neural pain, which is due to the direct damage to the nerves in the central nervous system. The other type of pain is musculoskeletal pain, which results from damage to organs. Organ damage may occur because the myelin sheath is not present to preserve the signals between organs and the brain. so organs are unable to transmit the message relaying their damage to the brain. As a result, the brain does not signal immune cells to go to the site of damage, so the organ remains damaged and dysfunctional. Other symptoms of multiple sclerosis include tremors and spasms. Tremors are caused by the damage to the cerebellum and the nerves leading to it, as the cerebellum controls balance and coordination. Spasms are caused by abnormalities and gaps in the myelin sheath of nerves, which disrupts the signals between the brain and muscles. In severe cases, such nerve damage can even lead to vertigo. Some multiple sclerosis patients may experience dysarthria, which is a motor speech disorder. It results from the lack of coordination between muscles used for speaking due to the insufficient nerve impulse sent from the brain to speech muscles. Other patients may experience problems with their vision caused by optic neuritis, which is the inflammation of the optic nerve. MS symptoms may also be characterized by bladder issues, which result from disrupted communication between the brain and the muscles of the bladder and cause the bladder to be hyperactive. Patients of multiple sclerosis may also experience various emotional, cognitive, and mental deficits, including but not limited to depression, mood swings, and anxiety. As of today, there is no cure for multiple sclerosis. Current treatments either treat the symptoms of multiple sclerosis or slow the progression of the disease. For instance, doctors may prescribe corticosteroids to multiple sclerosis patients to reduce nerve inflammation. Plasmapheresis is another procedure commonly undergone by multiple sclerosis patients. It involves the separation of the plasma from blood cells. The plasma is then removed from the body, after which purified plasma is reinserted into the body. This procedure is thought to reduce inflammatory factors that cause neuritis. Other treatments, collectively known as disease-modifying therapies, or DMTs for short, have shown to slow disease progression in MS patients. For instance, ocrelizumab, sold commercially as Ocrevus, is the only FDA-approved DMT for primary progressive multiple sclerosis. Interferon beta medications are the most common injectable DMTs for relapsing remitting multiple sclerosis. Fingolimod, dimethyl fumarate, diroximel fumarate, and others are oral DMTs for relapsing remitting multiple sclerosis. Doctors also recommend therapy for MS patients to relieve symptoms. Physical therapy is often recommended to improve muscle stiffness, coordination, and balance. Cognitive therapy may be utilized to improve cognitive functions, and counseling is recommended to deal with the emotional effects of MS. As can be seen, there is a dire need for a cure for multiple sclerosis, a treatment that not only slows disease progression and alleviates symptoms, but also reverses demyelination and repairs nerve cells and their myelin sheath. As such, several therapies are currently being proposed and studied as remyelination agents for patients with multiple sclerosis. Non-myeloablative hematopoietic stem cell transplantation involves transplanting multipotent cells into the area where demyelination has occurred, so that they may rebuild the damaged myelin and oligodendrocytes. Research has shown that this therapy slows disease progression more than DMTs. Another potential treatment for MS is vagus nerve stimulation in conjunction with training therapy. It treats mental, physical, and cognitive defects in MS patients by stimulating the vagus nerve, which increases brain plasticity to help patients relearn the behaviors they no longer can do post-disease. Since this procedure has only been tested on animals as of right now, there are no results that can be referenced to describe the efficacy on MS patients. This brings us to the drug in question, Bazedoxifene acetate. Its active ingredient is bazedoxifene, which is an organic compound. Its parent molecule is 2-phenylindole, and it is a third-generation selective estrogen receptor modulator. This means that it serves as both an agonist, meaning that it binds to a receptor to produce a response, and an antagonist, meaning that it binds to a receptor to block this response. Whether the drug serves as an agonist or an antagonist depends on the tissue that it is deployed to. Bazedoxifene acetate is not a new molecular entity. It was developed by Pfizer in 2009 and approved for use by the European Medications Agency shortly after. This drug was approved by the FDA in 2013 for usage in conjunction with conjugated estrogens for use in menopausal estrogen therapy. Today, this drug is commonly used as a treatment for bone issues in postmenopausal women, especially those with osteoporosis. Research is currently being done to study the role of bazedoxifene in combating cancers like breast and pancreatic cancer, as well as autoimmune diseases like multiple sclerosis. Bazedoxifene alone is sold in the market under the brand names Conbreza and Viviant, and bazedoxifene, in conjunction with conjugated estrogens, is sold under the brand names Duavi and Duavive. Here is the chemical structure of the active pharmaceutical ingredient bazedoxifene. Bazedoxifene plays a unique role in multiple sclerosis. Research has shown that bazedoxifene targets the enzyme encoding 3-beta hydroxysteroid delta-8 delta-7 isomerase, also called EBP, which is a key enzyme in the cholesterol biosynthesis pathway. This enzyme has previously been shown to be a target for remyelination and acts separately from the usual target of this SERM drug, the estrogen receptors, which play a significant role in treating osteoporosis. EBP then interacts with oligodendrocyte precursor cells to stimulate the differentiation of these OPCs into functional oligodendrocytes in pathways that are still being explored. As aforementioned, multiple sclerosis results in damage to the myelin sheath, which is constructed by oligodendrocytes in the central nervous system. The production of functional oligodendrocytes enhances the creation of myelin, which can either form myelin for new neural cells or are involved in the remyelination of nerve fibers that have been damaged by immune cells. Much more research must be done to determine the efficacy and safety of bazedoxifene acetate in MS patients. This drug is currently in a clinical phase 3 trial for multiple sclerosis patients, but a fully functional remyelination agent can prove to be a life changer for patients that live with multiple sclerosis. Here are the references used to obtain the information and pictures in this presentation. Please refer to these for further reading on the topic. This presentation template was created by SlidesGo, including icons by Flat Icon and infographics and images by FreePic. If you have any further questions, please contact me on my work email listed below. Thank you for listening.